1 in 5 adults in America have mental illness. So I want you to remember that number next time you're walking in Walmart or at work. 1 in 5. They're your doctors, your teachers, your ambulance drivers, everybody. It's not exclusive to just one demographic. Depression is more than just a feeling of sadness.
A lot of what gets people stuck is past, and that past doesn't always stay in the past.
I got very depressed because I was just existing. I wasn't living, and I was watching everyone else live without me. And I think the hardest part was the resentment that I saw with my children. I knew that I was either gonna die from my illness or I was gonna die trying. Either way, I didn't want to go out without a fight.
Nobody wants to admit that they have mental illness. Nobody wants to admit that they're addicted to anything.
And I think that we have an association with people with mental illness, that they're weak, that they're unpredictable, that they're stupid, and none of these apply.
So much of behavioral health is an influence of the environment that individuals live in. This is a different kind of public health issue. It's not only, with the legal drugs and things, but we know that prescription drugs are equally at fault here.
We had long access times, we had long accessibility to service times, and people were struggling.
Addiction is a really hard thing to understand if you haven't been through it. I do believe that addiction is a mental health issue because it imprints in your mind. Like, it's a habit that you pick up.
And there's no other epidemic or crisis that is more important than this right now. And our community is really coming together to develop a solution.
Our local healthcare partners in both Mercy and Cox Health were extremely important. They had worked around some of the deficits of community mental health over the past few years. And Jordan Valley Health Center was also an entity that really stepped up and said, if we need more services here, there's a gap, why don't we look at things that we could do as an organization to do our part, so to speak. And so right out of the gate, what we wanted to do is we wanted to create more access points for people. We can't wait for people to come to us. We have to go to where the people need us. If you go to your primary care doctor or you go to the emergency department, there's a chance that you're gonna have a behavioral health expert, a borough employee located right in one of those organizations.
It's not like treating a cold. It's not like treating a filling. Behavioral health's not like that. And I think that's really the challenge as we've looked at it.
Something that I learned today was that men are 221% more likely to commit suicide than girls. And I can believe that because back when I was using, I actually had a lot of friends that committed suicide and succeeded with it. And then I had some other friends who attempted it, or other friends that even wanted to.
In the United States, our suicide rates are going up when they're going down the rest of the Western world. And Missouri rates are higher than U.S. rates. Greene County rates are higher than Missouri. And so we know that we're at the very eye of this storm, and the rest of our community doesn't understand that, I think. So the good news is the data can help articulate the problem that our providers know about, and then hopefully that brings us together to make those changes we need to improve.
I want our community to know that it's real. I want them to know that having mental illness is okay. It's not something that necessarily gets gotten over, but not doing anything about it is what leads us to be stuck in the then and there.
So when they come through this clinic at Jordan Valley, we can show them smiles on people's faces. We can show that there is hope for them and that they can be successful.
Anxiety and depression can sometimes make the simplest tasks more complicated, but that's what utilizing a support network is also for.
Recovery for Samantha or anybody dealing with an illness doesn't mean that it's over. It means that they're learning how to deal with the issues that they have. So you can't expect, say as a family member or a friend, when they say they're in recovery, to just think, okay, well now everything's fine, because this is something that they will have to deal with. The stigma that is attached to mental illness is really an issue.
Being embarrassed has nothing to do with it. Nobody's gonna look at you and judge you if you go and get help. They're gonna be proud of you. Yeah, if you don't get help and you keep using, some people are gonna look at you and blame yourself for it. But if you actually go to a rehab center, what do you have to be embarrassed about? You're helping yourself.
The more we talk about it and normalize it, the more people are going to come forward and feel like they can talk about it. It's going to take everybody collectively working together to make a change, because it is such a big undertaking.
Our hope for the future is that we can be as proactive as possible and continue to meet the substance abuse and mental health needs that our community faces. It's a crisis right now, and we're being reactive, but our hope for the future is that our organizations, agencies that are involved in the Healthy Living Alliance continue to come together to be proactive and to develop the programs that our community needs in order to stay ahead of this.
Because we're seeing very rapid response to these issues that we've never seen before, and I attribute the health assessment in part being a mechanism, this community assessment, to get us together and remind us that we can cooperate and work together. And it's really been very material, and so there's a lot of hope in me, and that we'll see these problems turn the positive direction.
I want a happy family. I want to support my family. I want one of those houses with the white fence and just that movie life.
Recovery was possible for me, and I know it can be for you too.